Our mission at ThedaCare is to improve the health and well-being of the communities that we serve. And we know that about 80% of what creates health is really fostered in our communities outside of the walls of our hospitals and clinics. And so the last 3 years, we've been focused on really 4 main initiatives as part of our community health improvement plan.
Coming out of the pandemic, mental health and substance use were 2 of our top priorities. A lot of people were struggling from our youth through our adult populations. One of the things we started implementing was sources of strength with our rural high schools. ThedaCare invested over $275,000 to bring this program to 16 rural high schools and reach over 1,600 peer leaders to change the culture so that students could recognize and teach each other what their strengths were that they tap into in times of stress and crisis. For substance use issues, we have been able to implement programs like ED to Recovery and financially support standing up sober living homes for people in our community.
ED to Recovery is if someone comes into the emergency department and they are either in withdrawal or actively having symptoms of withdrawal. It is a way to bridge that gap so that they have a warm handoff to another human who understands what they're going through, to help coach, to help support, and to maybe get them connected to those other cares that they need so that the other joys of life, the other requirements of life can really be the focus, which is really important for all of us.
Over the last few years, we have been screening our patients, both in the emergency department and inpatient, to see what their social needs are. And we found that in our rural areas, transportation is a really significant need.
Employers were not able to get enough employees because of transportation issues. When you can't get employees in the door or applying for open positions, it gives them the opportunity to look at other populations, other areas.
Through our new London Community Health Action Team, or CHAT team, that group pulled government, local businesses, and other partners together to develop a robust employment transportation program.
We were awarded a $3.2 million Workforce Innovation Grant by the state. We were able to purchase 5 vehicles, develop our own rideshare program with a technology platform that allowed for people to request rides as long as it was going to an employer in Waupaca County.
"90% of a child's brain development happens within their first 5 years. Through some screenings we were doing in our clinics and with our community partners, it was identified that our children were really creating a gap in development related to language development and their social emotional health.
With ThedaCare and their innovative way of bringing the community together, we realized we needed a collective impact group, and that's how First 5 was born, bringing partners together to work and removing the gaps and the barriers to accessing services. Parents then were able to plug in to Help Me Grow, which is like a resource grid where you come to one space and you know where to go, and we give you the support that you need. The beginning of COVID, 43% of children were not meeting their regular outcomes developmentally. In 2024, we're up to almost 55% of children are now on normal trajectories. We see the change, and we know what we're doing is making an impact on these children's growth and development in really profound ways. And we don't do it in isolation. We do it with partners, because that's what collective impact is all about.
The health issues that our communities face are so vast that there's no one organization or institution that can address them alone. So it's vitally important that we partner with community members and organizations to achieve health and well-being. ThedaCare has played a lead role to create a group called the Tri-County Community Health Improvement Coalition of those major public health, community, and health system leaders so that we can have a common direction to help with that greater alignment. Creating alignment across the needs assessments and plans for public health systems in our community is a really big deal. That hasn't been done ever before.
In the past, all of our local stakeholders were all working in their own silos. And what this collaboration has allowed us to do is free up resources within those agencies, and it allows us to come together and move forward to focus on a single health topic in a much more powerful way that we wouldn't have been able to do in the past.
While the Tri-County Community Health Improvement Coalition is focused on the Fox Cities area, we are working with all the public health directors and many partners across the entire ThedaCare footprint to create that needs assessment and common plan strategies together. So the power that comes from this collaboration really has the potential to dramatically impact the health and well-being of Northeast and Central Wisconsin. Over the past 3 years, ThedaCare has contributed more than $180 million in unreimbursed services to our communities. All of this work is in service of helping people live their unique best life. It's a never-ending work in progress to align with community partners to continue to make a better place, a healthier place for everybody that we serve.